Tomorrow's briefing, to remind everybody, will be at 2:30, and then every day thereafter at 1 o'clock. Usually I begin by thanking all of you for tuning in, and I will do that, and thank you for keeping yourselves informed. It's one of the best things you can do during this crisis. But I do want to take a minute to thank the members of the media. Like many of us, they too have been working overtime. They've been giving us a lot of good information around questions people are asking. We've been trying to answer those questions, and I know this format is far from ideal, and you've been working with us. So thank you for all the extra work, and thank you for keeping Rhode Islanders informed. I will say the amount of misinformation flying around on social media is probably getting worse, not better, or at least more voluminous, and so your role as responsible journalists is more important than ever. So thank you for what you're doing. Okay, a bunch of announcements today. I'll go through them all as per usual and then come back to answer questions. You can see the data on the screen, which will indicate to you that our cases, unfortunately, are still rising, not declining. Pretty steady, which is the good news. Clearly, we are flattening the curve. Clearly, the peak isn't going to be nearly as bad as what it could have been, which means that all of your hard work in obeying the stay-at-home order is really working. It's absolutely working. It's saving lives. It's preventing our healthcare system from being overwhelmed, and it's going to make it so that we can all get back to work sooner. So I want to thank you for that. Having said that, you'll see more cases today, more today than yesterday, 394 today. So we're still not leveling off, but I am hopeful. I hope that we'll start to see that soon. As I mentioned yesterday, and as I've mentioned almost every day, my goal is to reopen our economy as soon as possible, but as safely as possible. And when I say as safely as possible, I mean reopen the economy, but getting rid of the risk that we might again see another surge. We might see outbreaks, but we hope that they will be smaller, more manageable, quickly identified, and we can deal with them. But we never again want to be in a situation where we see this full-blown surge and we have to shut everything down. And as I've said, due to your hard work, we've really done an excellent job of kind of bending the curve or flattening the curve. Having said that, it's still a scary time. It's a scary time for everyone. And I have a feeling that although I'm now saying you have to stay at home until May 8th, and I'm very serious about that, we absolutely have to stay at home. It is not time to take our foot off the accelerator. If we do, we risk going backwards. But pretty soon I'm going to be saying to you, let's be brave together, and let's get back out there under a safe set of circumstances. And so I'm just trying to orient you to where we're going to be going, hopefully a few weeks from now, assuming that we continue the positive trends that we're seeing now. And yesterday I spoke about the 6 indicators that I'm using to measure when we can reopen the economy. And I mentioned that one of the indicators was making sure that we had enough personal protective equipment for all of our healthcare workers, and actually for everyone. I suspect we'll be going into a new normal where you're going to have your temperature checked before you go into work. You're going to have to wear a mask while you're at work. And especially for healthcare workers, we have to make sure they have enough masks and gowns and goggles and gloves and such in order to be able to do their jobs safely. And so we're really working incredibly hard to make that happen. Our goal is to have a 30-day supply of PPE on hand at all times. Not quite there, but moving in that direction. For me, one of the hardest things to hear, I end my night every night by reading through a lot of the notes that people send to me. And by the way, many of them are heartbreaking these days. But some of the hardest stuff is from frontline healthcare workers who say they're afraid to go to work, yet they are going to work. They know they have a duty to serve as a social worker, therapist, nurse, certified nursing assistant, but obviously they're anxious, and on top of it, they're having to reuse their surgical mask or their PPE, for too many days. At the end of a long day, they put it in a bag and have to reuse it again the next day and the next day. And that's really tough to hear. And so you shouldn't have to do that. We can never thank you enough, those of you who are in the healthcare system and continuing to go to work, showing up faithfully, even though you're scared, in a nursing home, in a congregate care setting, in a group home, working with the developmentally disabled. Of course you're afraid, but you're heroes. You're brave, you're doing it, and we can never thank you enough. What we can do is work harder to make sure that you have more and better protective equipment to keep yourselves safe. So I have a bit of good news to share, which is that in the past 2 weeks, we've received shipments totaling more than 1.5 million surgical masks, 90% of which has come from the private market, by the way. Everybody says, oh, the federal government's supplying everything. These masks we have had to scour the world for and purchase on the private market. And we continue to do that, by the way. That brings our total on-hand masks as of today to just about 2 million masks. So that means that healthcare workers across the state, in hospitals and nursing homes, urgent care centers, primary care offices, other areas of congregate living, can now change your surgical masks on a daily basis. I realize that's slight consolation, but it's improvement. It's an important sign of hope that at least now you can get a fresh mask every day, and it's a signal that we care for you, we care about you, we're grateful to you, and this is just the beginning. It's going to continue to get better as we continue to get better at resourcing you and these settings. And I know we need to do more. If you're an eye doctor, oncology center, diagnostic centers, we have to do better by you as well, and we will. The supply is opening up. We have 2 million now. We have many million more on order. The same thing for the N95s and the gowns and the gloves. And I hope that, in the next few days or a week, I'll be able to make more announcements of greater purchases of PPE and our ability to distribute this even more widely. I also want to make a special note about the field hospitals, which as of today, 2 are ready to be operational. I have to give I can't say thank you enough to General Callahan at the National Guard, who's just been a rock through all of this. His leadership has been outstanding. And in particular, standing up these field hospitals has been nothing short of extraordinary. Similar thank you to the EMA and those workers. A huge thank you to the Rhode Island Convention Center for your collaboration and cooperation, and also to the owners of the Citizens Bank building in Cranston. I have to thank Dr. Tim Babineau, who's the CEO of Lifespan, and Dr. Jim Finale, the head of Care New England. You and your teams have been outstanding, and I can't thank you enough. I want everyone in Rhode Island to understand what has happened here. A few weeks ago, we were looking at models which showed that we were going to need potentially 6,000 or more hospital beds at the end of the month of April. I think all of us walked around every day, all day, with a pit in our stomach, looking at these models, looking at the reality. How are we going to do this? How can we possibly get this done? I personally was on so many phone calls with Dr. Finale, with Dr. Babineau, with General Callahan, pulling our hair out. What are we going to do? How are we going to do this? This isn't possible. How do you build a hospital in a few weeks? It should take 6 months. And they did it. They did it. I had the opportunity to walk through these field hospitals, and it's nothing short of a miracle that they got it done. And to all the men and women who literally worked around the clock to make it happen, I can't thank you enough. Due to the collective efforts, there's an additional about 1,000 beds in these hospitals that are ready to serve Rhode Islanders should we need them. And we call them field hospitals That's the nomenclature that the federal EMA uses. But these are not, crisis care standard type hospitals. Obviously, it's in a convention center. It's not a hospital. But they're places you could get better. And we also have staffing plans and staffs available at a level where you could get better. So thank you. I sleep easier at night now knowing that if there is a surge, if at some point in the future, God forbid, we need these hospitals, they are there. They are ready, they can be staffed, and they are top-notch. So thank you. Because of the great work of the people of Rhode Island in obeying our stay-at-home order, we don't need these now. And we may, praise God, we may never need them. But if, when we reopen school, there's a surge, or we go back to opening the economy, or we see a seasonal change in the fall, as some predict, and we do need them, I want you in Rhode Island to know they are there, they are staffed, they are top-notch, and we will take care of you and in the best way possible. With respect to staffing, while I'm talking about staffing, I want to make another plug for the Skills for RI website. So right now we have many, many people who are out of work, and that's something that we need to get to the business of fixing as soon as we can. But we also have thousands of openings, particularly in healthcare, grocery stores, other essential services, where these employers are desperately looking for workers. There's a lot of organizations who are trying desperately to fill open positions as fast as they can, and we know we have thousands of Rhode Islanders out of work. Skills for RI, skillsforri.com, is a matching website that we set up about a week ago. And I would ask anyone who's looking for a job, who wants to work now, who wants to get paid to work, go to skillsforri.com. There's thousands of jobs available. Check it out and apply for one. If you're an employer who's struggling to find folks, you also can go there and put your search online. Continuing on the theme of supporting our frontline workers, I want to revisit the topic of providing safe housing and shelter for our frontline workers. Again, as I listen to Rhode Islanders, and I try to listen to as many as I can every day, you hear from people who might be a police officer, caregiver, home health care worker, some nurse, and they're afraid to go home. They're constantly exposed, they think, potentially, to the virus. They have a busy, large family at home. Maybe they're living with their mother or grandmother or older aunt and uncle, and they're just afraid to go home because they don't want to spread the disease. And so we've been working hard to provide options for these folks to live safely, have a safe place to sleep at night. Last week, we launched rihavens.com, rihavens.com, and that connects frontline workers in need of a place to stay with hotel rooms. And there's a variety of hotel rooms. Some of them are as inexpensive as $25 a night. Thank you to Hotels and the Hospitality Association. And others are obviously more expensive. Having said that, even at $25 a night, that adds up if you stay there for a few nights. So I've been working to try to find free options. And I'm very pleased to announce that as of today, we've partnered with Brown University to provide free single occupancy dormitory housing to frontline workers. Brown has made more than 700 rooms available to the state for free. Thank you, President Paxton, thank you to your team, and thank you, Brown University, for stepping up without hesitation in Rhode Island's moment of need. It's fantastic, it's extraordinary. Not every university and every state is willing to do it, and your team has been such a pleasure to work with. Now, anyone who's ever lived in a dorm room knows this isn't exactly a five-star hotel, but the rooms are basic, they're clean, they'll be cleaned daily. It's single occupancy living. Brown has arranged for laundry service and food service that you'll obviously have to pay for additionally. Bathrooms are, in most cases, communal, but it's a free, safe, clean place to stay if you're a frontline worker who either can't go home or is afraid to go home and needs a safe place to stay. Again, I have to thank my team. As you might imagine, setting this up is a logistical challenge, to say the least, and they did it. In just a few weeks, 700 rooms available for free for the people to whom we should all be the most grateful right now, which is our frontline workers and first responders. Let me say, I'm sure there's going to be a lot of questions. Who can use it? Who can't? How do you sign up? So this is for frontline workers. These are for folks who can't stay home right now. They have to go to work. So that is any medical personnel, any first responders, any members of public safety, any nursing home workers, any congregate care workers, so that's group home settings or any other settings, any home care workers, anyone in a position of providing direct care and service, and like I said, is either afraid to go home, can't go home, this is available to you. This is not for people who have tested positive for the virus and need to be in isolation. That's not what this is for. And as I said, there are communal bathrooms, so this is not a great place for isolation. Workers who are if you're listening to me say this and you think, that's me, I live in a crowded household, I have some elderly relatives, I need a good night's sleep and I'm afraid to spread my germs, this is for you. You should talk to your boss about it. We are going through all of the first responders, nursing homes, home care agencies, et cetera, to make it available. And you can ask them, and they can tell you how you can sign up for a room, and we will make that room available to you. If you have coronavirus, if you've been tested positive, you do need to isolate. And if you are housing insecure, or just, you don't have a place you can isolate, then you have to let us know. You can call the Department of Health, and we will help you find a safe place to be in isolation. Which leads me to my next point, which is the Wyndham Hotel in Warwick. So we have leased the Wyndham Hotel in Warwick for the purpose of safely quarantining and isolating people who are housing insecure. But we're getting a lot of calls from people in the homeless community and otherwise just looking for a room at the Wyndham. Unfortunately, that is not a service that we are able to provide right now. We're working overtime with the housing community and homeless advocates to try to take care of everybody, but the Wyndham is not for that. In order to be able to have a spot at the Wyndham, you have to be directed by the Department of Health to go to the Wyndham. So the Department of Health will make a determination, and they will decide if you get one of the rooms at the hotel. Sorry if it's confusing, but at least from where I sit, none of this was available a few weeks ago. We had no field hospitals. We didn't have the Wyndham. We didn't have 700 rooms at Brown. We certainly didn't have enough PPE to tell everyone they could not have to reuse it. And in a very short period of time, we're building a system that should give you confidence, so that when we get back to the business of emerging from our homes, I want you to have confidence. We're not going to do that until we feel ready. And all of this should give you some confidence that we're building a system so that when we get back to work, we will be ready and we will do everything we can to keep everybody as safe as possible. Until that happens, sadly, and of great distress to me, is just how devastating the economic impacts of this virus have been on our economy. It keeps me up at night. I'm sure it keeps a lot of you up at night, not being able to pay the bills, not knowing how you will pay the bills. We've had 170,000 unemployment insurance claims filed in the past 6 weeks. That's never happened before in our state's history. It's truly unprecedented. I'm going to tell you today what I told you yesterday. We're going to get you all back to work. We are going to stand this economy back up together, and we're going to do it as quickly as is safely possible. But in the meantime, we're also going to make sure you get the support that you need in order to get through it, because it's going to be a while, and when it comes, we're going to reopen in waves incrementally. So I'm very proud of the team at DLT. I don't know how they're doing it. They're doing better than any other state that I can find. We were the first, or one of the first states to start processing the pandemic unemployment assistance. We are processing claims faster than almost every other state. And somehow they're doing it with a system that is very old, technology that is very old, and frankly, a system that was not built to process 170,000 claims in a few short weeks. So to Scott Jensen and the team at DLT, man, we can't thank you enough. I receive notes every day from people who are desperate to get those checks. And I want you to know, Scott, that we appreciate all the endless work that you're putting in. To that end, we had a big breakthrough over the weekend. As you may or may not know, when you're on unemployment insurance, the federal government requires you to certify on a weekly basis that you're still unemployed and therefore can get your checks. Typically, that happens on a Sunday. So on any given Sunday, the system is overloaded with phone calls, people calling in at the end of the week, the beginning of the next week, to recertify that they're still unemployed. Now, many of you hearing me are probably saying, yes, Governor, we know, because when we call on a Sunday, all we get is a busy signal, or you can't get through, or you're frustrated, and I'm sorry for that. Here's what I can tell you. We have upgraded the system. We've moved heaven and earth to work like crazy over the past couple of weeks. We've upgraded the system with the help of Amazon Web Services to have very enhanced technology. And on account of that, this past Sunday, 2 days ago, we were able to recertify 75,000 people the moment they called in. People didn't have to sit online, and there wasn't a busy signal. So hopefully that was your experience on Sunday. You didn't have that busy signal, and I hope that that'll continue to be your experience, that you won't get the busy signal, because we're able to process tens of thousands of calls every day on account of the Amazon Web Services upgrade. I also have to thank BJ, who's the state CIO. BJ and his team are unbelievable. One of the efforts that we've made over the past couple of years in the state, in my administration, is to really beef up and professionalize the state's IT department. And under BJ's leadership, we've done that. And things like this couldn't have happened a few years ago. Now they're happening, and I want to thank you for all of your hard work. By the way, it doesn't mean you're not going to have to wait 7, 8, 9, 10, 12 days for your unemployment insurance check. I'm sorry, that is still the case. We're doing our best to make that happen in a more expedited fashion. I want to end on a positive note. As I said, I get lots of emails every day, lots of people reaching out in all different kinds of ways, and they come in a couple of different varieties. Many of them are, Governor, please help. Help in some way or another. The level of suffering is pretty high right now, hardship, and I love hearing from you, and everyone we hear from, we do our very best to help. And then on the other side, there's lots of really heartwarming stories. People going out of their way to offer help. How can I help? You know, people sending us homemade masks. Thank you, Rosa, in the Department of Health. She gave me another installation of gorgeous homemade masks. People giving us money, people delivering food, people offering me suggestions and ideas. that gets me through the day, and it gives me confidence and hope that Rhode Islanders are a resilient, confident, hopeful people, and we're going to get ourselves through this. Yes, we get frustrated, but we are together going to rise above that frustration and do the right thing for one another and for our community. So today, I received the following beautiful note. It was actually a note that was sent to the Rhode Island Foundation and forwarded to me. Today, the Rhode Island Foundation received a $1,200 personal check for their COVID-19 response fund, along with this note. Here's my stimulus money, which others need even more than I do. That's exactly the spirit that's going to get us through this. So thank you for doing that, and it inspires me to keep doing my best for all the people of Rhode Island.